We're going to explore a few of the cognitive biases that actually control how we make the health decisions we do. Now, there are actually over 170 cognitive biases. I don't know why we keep adding cognitive biases. I don't know why we have so many.
Welcome to Reclamation, the podcast where conversations meet practical insights, guiding you through the maze of behavioral science to empower better public health outcomes. With a passion for bridging the gap between medicine, psychology, and sociology, Tabo brings a unique perspective to every episode. Get ready to reclaim your understanding of health and behavior. This is Reclamation.
Welcome back to Reclamation. You've made it to the third episode. Wow. So, it's actually so hard to talk so clearly and try to be fluent and try to be clear enough for people to understand what you're trying to say without them having to see you. And so it got me thinking about how I decided to start this podcast. Before starting Reclamation, I had to think about why I wanted to have the podcast. I had to think about if I was capable of actually hosting a podcast, if I had the time, if I had the energy, what I wanted to talk about, who the podcast is for. And that made me realize just how much thought got into the planning of the podcast, the planning of the episodes. What am I going to talk about? Who is it for? Is it going to be beneficial? Is it, everything, how am I going to record it? How's the editing going to be done? On what platforms? There's just so much thought that goes into preparing for a podcast and putting up an episode. But then this week I was attending a scholars bootcamp, and during the tea breaks we have options of having either coffee, tea, or a cold drink. And for some reason I didn't have to think it through. I automatically knew I had two options. Despite being given three, in my head, it's like I only had to choose between the coffee or the cold juice because that's what I like. That's what I prefer. And I had just been interchanging between the two continuously throughout the days. I didn't really give it a thought. It's not something that it just happened automatically. It made me realize how there's some decisions we make that we actually have to put so much thought into looking at, why do I want to do this? How am I going to do this? But then there are other decisions in our life that we make, and it's just, we don't really give it. It's like within 30 seconds, you know what you want to do. And I guess that applies to a lot of other things, because you can't keep spending so much time on simple decisions such as what color jersey, not what color jersey you're going to wear, because we do put some thought into that, but something like what example can I think of? What example can I give? Something about the type of spoon you're going to pick from your drawer when you want to have your cereal or something. I don't think it's something a lot of us go, and stand there and weigh the pros and the cons and the what and why do I want to do this? What's going to work better? You just pick the quickest because it's either what you do all the time or what you've seen being done by most people. And that is what we're going to talk about today. This episode is about cognitive biases. We're diving into the fascinating world of cognitive biases and their profound impact on health decisions and behaviors. When it comes to making healthy decisions, our brains play a crucial role. However, our brains are not always as rational as we think, and cognitive biases can impact our choices related to health and wellness in general. Nothing is more important to a human than health and well-being, yet certain cognitive and other cultural biases can impede the access to life-saving health and behavior interventions that we choose for ourselves. So cognitive biases are like silent puppeteers, I guess, pulling the strings of our mind and guiding our decisions in ways we might not even realize. So we're going to explore a few of the cognitive biases that actually control how we make the health decisions we do. Now, there are actually over 170 cognitive biases. I don't know why we keep adding cognitive biases. I don't know why we have so many, because I feel a lot of them keep overlapping or are somehow similar, or some I feel are actually the same thing, but then just very minimal, almost insignificant differences. But hey, I'm not on that level yet to argue as to what. So I picked 4 of my favorite that I think every single person should know. If you're trying to make better decisions in your life, if you're trying to make better decisions affecting your health, you really need to know these 4 cognitive biases and how they're actually working in your life, how they show up in your life without you noticing. They're literally sneaking up on a lot of us. So the first cognitive bias that I'm going to talk about is the confirmation bias. This is the first one on our list. So this sneaky bias leads us to cherry pick information that supports our existing beliefs, while conveniently ignoring the evidence to the contrary information. So imagine someone convinced that vaccines are harmful. That person is going to be scrolling the internet for articles that confirm their fears, and they will disregard all the other overwhelming scientific evidence supporting vaccinations. I'm sure we all know 1 or 2 people, right? And I mean, we saw this even during the times of COVID, and we see it continuously with all the other vaccines or all the other medications. So a lot of times you're looking for information, but you're looking for information to support the knowledge that you already have. So that can also impact how you make your decisions, what you think is healthy, what you think is unhealthy. Confirmation bias. Check, like, how has this been sneaking up in your life? Are they things that you believe in and that you can support with your life and pull out articles and Google, and somehow those are the articles you're going to concentrate on, even if there are other articles suggesting otherwise. So yes, that's a very interesting one because I see it a lot. And then, this thing where you hear about a friend of a friend who contracted a rare disease, and suddenly you are convinced it's more common than it actually is. So this is the second bias we're talking about. This is the availability heuristic. So this bias usually clouds our judgment, making us overestimate the likelihood of events based solely on how easily they come to mind. Because it's something that is stuck in your mind because you remember it was a traumatic story or it moved you emotionally, and all of a sudden you think, so okay, this is actually happening more often than it actually is. So for example, if we hear about a friend's experience with a particular diet or an exercise routine, we may assume it will work for us as well without considering our unique circumstances, leading to the biased decision makings. Like, there's so many things we don't factor in: our metabolism, our watts. It's just, it worked for this person, so automatically it's working for so many people, and then we think it's automatically going to work for me. We see this in the diet plans that we adapt. We see this in the exercise routines. It happens so many times just because there are so many people who are popping up on your timeline, on your social media pages, on the media you're consuming, who are testifying to a particular health habit, and you automatically think it's going to work for you because majority of the people seem to be doing it. I don't know, but I think this bias can somehow be used for good as well. I think it can be used to encourage good, healthy behavior. More like what I try to do with my story of taking my ARVs, having an undetectable viral load, and not infecting my husband and my little baby. I guess we are trying to use it, but are we using it as much as we could? Because I see it being used in HIV, like with my story. So automatically, if more people come out, then even the few people who have the stigma and the self-denial are encouraged to do it and take their medication. That's availability, because you feel, everybody else who's living with HIV is actually able to live a healthy life. So that is one way in which we could use the availability heuristic. But maybe we're not really using it enough in the health sector. I don't know. What do you guys think? Are there other ways you think we could use it better? Are they? So that was the second one, right? So the third one is the anchoring bias. So this is our next contender. It can really throw a wrench, in our health decisions. Imagine you're at the doctor's office and they throw a scary sounding number at you, like your risk of developing a certain condition. That number sticks in your head like glue, influencing your perception of risk, even when other factors suggest otherwise. So the anchoring effect states that an individual's decision is influenced by the first point of information offered, or the reference point, hence the anchor, like the binding, like the first piece of information you have, the first thought that comes to mind, you stick with it and you go with it forever or for life. So in such a case, it can present itself in, for example, a patient may feel signs of relief, after taking some medication for a few days, and you suddenly feel relief, and that sticks in your head, and you conclude that, oh, you know what, I'm cured, not realizing that the ailment may still exist in subdued manner, and the medication's course need to be fulfilled for full treatment. And I think this is the leading cause behind the looming global antimicrobial resistance crisis that we're currently facing. Because as people do not complete their prescribed antibiotic courses, the infection that is actually causing the microbes continues multiplying and are not completely terminated. Instead, they grow resistance to the microbials and become immune to treatment. We see this in so many antibiotics. We see this even the TB resistant, the multi-drug resistant tuberculosis. It's seen in so many other diseases as well. And hence we have this AMR crisis currently. So it's like anchoring biases or the anchoring effect. It's actually interesting how it is affecting our health. It's affecting us individually. It's affecting our community and public health in general. So moving on to the very last bias that I think is important for you to know. In the last episode on the rat pack and how the environment affects health behaviors, I talked about how I managed to adhere to my treatment by taking my ARV drugs and putting them near the socket in my room. So this is connected to this bias I want to talk about, the projection bias. So this is a common cognitive bias, and it often leads individuals to make short-sighted decisions based on their current emotions and belief. So this bias, I see it a lot in people who are living with chronic illnesses, especially because in that moment, you are so determined to change your life, so determined to live a healthy life, so determined to do right and follow the doctors and physicians' orders. You're given treatment, you're told to take it in a specific way, and you are so sure you're going to do it. And 3 days later, a week later, you are actually not taking it the way you're supposed to be taking it. This is the projection bias. So this bias arises from the tendency to overestimate how much our future selves will share our current preferences, values, and beliefs. So just because in this moment you're feeling motivated to do something, you believe that is always going to be like that in the future. In the realm of the healthcare, as I said, where chronic illnesses demand the long-term management and lifestyle changes, it's crucial to address this bias because we need to promote healthier habits and to improve patient outcomes. So the projection bias can actually significantly impact decision-making regarding health-related behaviors. So patients may underestimate the extent to which their future selves will prioritize their health, leading them to make choices that cater to their immediate desires and emotions rather than their long-term well-being. I mean, we see this in the patients that are struggling with substance misuse of a particular substance and are not ready to give it up because they believe they are okay, they believe they are fine, and do not realize or do not anticipate that in the future what they're actually feeling and believing, because what is currently happening is giving them immediate gratification. It might change. Their beliefs, their priorities might actually change. And that's why in the last episode, I talked about how I look out for future me because I might not always be motivated or remember to take the medication. So this is a very common bias we see. This is a very common bias we fall victims of. I mean, a lot of us actually fall victim of this in just the way we choose to buy our snacks. You know, when you're motivated, you're starting a new month and you're like, I'm done with all the junk food. I'm only buying healthy snacks, the fruits, the vegetables. And then later you get home 2 days in and you open your fridge, you open your drawers, and there's nothing that you really want to eat because you filled it up with the healthy stuff. So that is one way of actually trying to avoid this projection bias. That's one way of actually knowing about it and trying to do something about it because you know it's going to happen and you are looking out for your future self, as I had said. So that's something you need to ask yourself how it might be creeping in. Do you overestimate the future you, how capable future you is of looking out for yourself? So yeah, that's something to think about. So knowing about these cognitive biases is one thing, and I cannot say that you can completely avoid them. Being aware of a cognitive bias doesn't mean you can completely avoid them. It's almost like saying, because I am aware that bullets make ouchies, therefore I can dodge them. Like, we know bullets, we know the impact bullets have, but you can't always completely dodge them. But then the thing is, they are bulletproof. But the thing is, there's still bulletproof armor nonetheless. So it's something to actually know. It's definitely not going to help you avoid them completely. But if you know nothing about them, you can't do anything at all. And the people who actually know about these biases can weaponize them against those of us who may not actually know about them. So what can we actually do now that we know them? We need to equip ourselves with some tools to combat their influence on our health decision. Tools such as seeking diverse perspectives, surrounding ourselves with a variety of viewpoints can help challenge our biases and lead to a more well-rounded decision-making when it comes to our health. Like, we need to hone our critical thinking skills by questioning assumptions. Like, just because we've always believed something doesn't mean it's true. So by interrogating our beliefs, we can uncover hidden biases that are actually contributing to our decision-making when it comes to health. So biases aren't actually completely bad. Biases are not bad. We humans rely heavily on these cognitive biases as they can actually help us. We wouldn't want to unlearn all our autopilot features that help us get throughout the day without having to spend ridiculous amounts of brain power making small decisions. But that self-awareness can be really helpful to make sure we are not on autopilot all the time for decisions that actually do matter. So what biases have you actually been falling victims of? Can you think of any? Have you looked up any others? What other interesting biases have you found? As I said, there are over 170. So how are these biases appearing in your life? How are they affecting that health behavior you have been stuck to, that you've been believing in with all your heart? Like, I'm hoping me sharing a bit about this will open a worm of you wanting to seek more knowledge into looking at this and trying to avoid it and be wary of it, and make sure that the people who actually do use these biases, the people who are after our money, people use it for marketing, you're actually not falling victim of these biases. Please let me know if there are any other interesting biases that you found. You can please share them on the comments if you're listening to this on YouTube. I would really like to hear about these biases and how you think they have shown up in your life. So that is it for today's episode. I hope after this, we have realized just how much power our brain has, and we can actually use that power for good and to change our lives. So that's it for today. Thank you for joining me till the very end. In the world of behavioral science, every ending is just the beginning of something new. Please remember to subscribe, leave a comment, and stay tuned for more adventures in behavioral science as we continue our journey towards a healthier, more informed decision making. Until then, stay curious, stay vigilant, stay healthy. This is Thabo Lukato Hadonka signing off from Reclamation.